One other thing that we had done in the beginning too was just some noodle push downs in the front and at the side. You want to just show a couple of those? And those are really very easy for her at this point, but it's just a good beginning exercise too. We also, her first couple sessions, we did do a little bit of walking on the treadmill the first 1 or 2 times just to work on some arm swing, but she quickly advanced past that. So just getting the gait back, getting the swing, not compensating. For a lot of people, not so much in her case, but people tend to really guard that arm and hold it up close to their body. So it works well just to work on some swing. So in the beginning, many times that noodle offers a lot of resistance to people, especially when you're using it just on the involved arm for up and down. Oh, I know what else to do, Shelley, behind you, with 2 hands behind. Gets a little internal rotation stretch again, too. It's the beauty of the pool. You get a good workout to all the other muscle groups, too, not just that shoulder. Legs have to stabilize you, and the stomach muscles. So those are just aqua fins. Yep, so just start with... This is more strengthening. And just having her focus too on her scapula movement and trying to make sure both sides are equal has been a big key. When we first started, she definitely did more substitution, a lot of shoulder elevation. So she's improved quite a bit from the first visit. Really keep that elbow at your side. This one's tough. This is just trying to work on external rotation, and as you can see, she tends to let that elbow come away from her side. And then Shelley, you can switch to those diagonals. Just really coming down to that. Try to really actually come down to your opposite hip. And then these were the ones where we added your head to turn with your arm, just to get some cervical range of motion into, because so many times the upper trap and levator gets tight. Doesn't really turn the head this way too. Like when you're down, turn your head all the way. There you go. Good, and then try the opposite too. So when your arm's out here, there you go. Just getting opposite neck motion, stretching those muscles. All right, that's, well, I know, we did the 8s too, figure 8s. Good. All right, so why don't you take those off, do that little hip stretch this way. So just to stretch into internal rotation, adding that HydroFit cup just adds that little bit of buoyancy. So just try to stretch it back there, Shelley, and hold it. To be so careful for compensation. I mean, people tend to really like flex their wrist or extend. Now, when we first started, I think she could barely get to your butt. Yeah, so that's really some nice progress. Yep, grab a noodle. And we'll have you just first do like the snow angels up over your head. So just some supine floating to work on. Oh, she's going to lock her feet in the side so she stays still. That helps. So just to work on some ab and adduction. And again, just focus on, lots of times too, I'll get in the pool with somebody and just feel their scapula to give them that feedback of how those are moving. So just working on the symmetry of that. I would say if somebody has a shoulder injury and gets in the pool, if they don't want to get their hair wet, they aren't going to reap the full benefit of the pool. And same thing with if they're willing to learn to use the snorkel and mask, it makes a tremendous difference in their progress. Because as you can see, if you work just in standing, you pretty much can get to 90 degrees, and that's it. The other one were those clocks. So if you start down here, just get those shoulder blades. So you're just kind of pushing down. Just working on, again, just some scapular strengthening. So it's just, I call it a supine clock exercise. If you start with your arms down at like a 6 o'clock hour and just work on pushing down into the water, it gets the scapular muscles engaged again. And then work your way up to the 5 and 7 o'clock and do the same thing. And it gets progressively harder as you work up to 3 and 9 and then way up to overhead. repetition. People tend to fatigue with this a little more quickly. The other thing, let's see if I can get these. So the bells just add a little extra level of resistance too. So Shelly, with these, just keep those palms up, and it's just that same, actually think of pushing the bells right down to the bottom of the pool. Not literally, but that's the motion. So that just adds that extra bit of resistance. And again, with that, you can start at that 6 o'clock with your hands down and just progressively work on going up. And it definitely is much harder the higher up you go. And it just gets those middle traps, lower traps, rhomboids. See, and you can see definitely with their right arm, it doesn't go quite as well as the left. All right, why don't we do that mask and snorkel? So actually, before I would show anybody the mask and snorkel too, usually we go over, I would start them first with the mask and snorkel on and just doing a little bit of squatting to get used to the breathing if they haven't done that before. Also work with them on how to get back up once they're in this lying down position, because sometimes people get in that panic mode. Many times I'd be in the pool with them the first time that they did this. So what she's starting with now is just a little bit of stretching. Just slow that up a little. Yeah, there you go. So just kind of pulling in for a little rest and then stretching out, hanging on to the side of the pool. Shelley, you can hold it a little more. Yeah, stretch right out there and hold it. And again with this, the snorkel and mask just puts the neck in such a much better position and alignment. If she were lying like that, and her neck would be really almost hyperextended. She can say that's a great stretch. She was not able to tolerate any of this on land. Was just almost impossible. Just from a pain standpoint, she got in the pool and was really able to move. All right, and then what we also did, we were kind of held down this way, and then you can also stretch with the hand and a little more external rotation to get a little combination of external rotation and flexion stretch in that same position. So yeah, if you want to turn around and just hook your feet in there, and then range of motion wise, the snorkel mask is another great way to work over 90 degrees. So just working on, start with that flexion, yep, so coming up, and then the snow angel type of movement. Just changes that stretch of the shoulder again. So here's just getting a little more external rotation. Also, again, just working a little more middle trap. So as you can see, it's a little harder for her to get up to 90 degrees because of the lack of external rotation. You can do a nice stretch here too, again with that HydroFit cuff for external rotation. So just getting into that position and holding the cuff. Just letting the buoyancy pull, yes. Again, in this position, lots of times people need cueing to just make sure to stay looking down at the bottom of the pool. If you start looking up, again, your neck just goes into that extension position. But to me, this is the way the majority of the patients that I treat with shoulder problems have made the best progress. The other one I was going to do was the barbell, those push downs with that barbell. So just do the straight push downs, like right at chest level, and then you can also do the stretch where you bring it up overhead and pull down. In this, you might start with just a noodle, a little less resistance. And many times people will really feel the difference in their involved side doesn't have as much control. So it just really works great for progression of control of that. And it's been nice to be able to get your feet to lock right in there, because then people can just focus on true shoulder movement versus moving all over the pool. So again, with the all the range of motion that we did, we showed that with no extra resistance, but you can progress to using the gloves, the aqua fins, you can use the hydrotone bells or the barbells, all for extra resistance. Let's just show that rotation stretch too, Shelley, with the mask and snorkel. So just taking this again and laying down kind of in this position. Not so much back, but more if you're here, remember just coming out into this position. So you get that stretch into the rotation. And then you can, come up into the internal rotation too. And then just, try to bend that elbow a little bit more. There you go. So that's that external rotation stretch. And then in the beginning, you may have to get in to just help stabilize that shoulder a little bit, just because of the way, like, especially for her injury was over a year ago, so all that learned compensatory strategies, like, she's really unlearned a lot of those by being in the pool. I think that's the piece that I find the most, is that people get in and they can really not compensate as much because of the, they're usually such much less pain. And then she tries to get into that internal rotation, which is, again, that's just such improvement for her. Make sure that hand stays, yes, because what people will do is just that. They'll cheat with their wrist because they feel like they're getting more motion. And someone like her, I believe it was this side that she had some carpal tunnel surgery on, so you want to be especially careful. Started using the jets for a little more resistance to just some push-pull work. The other two was just that push down and pull up too now. And then just, Shelley, if that's easy, remember the faster you go, the more resistance you get on the push down and pull up. And then that other, do you remember that rotation one? So you just pull the board here, rotate, and then just extend that back arm out, rotate, and just rotate all the way around. There you go, and then switch. You can also use a kickboard for these exercises too. You can try those the rotation ones too, Shelley, with the elbow locked right at your side. Over the, it's not there, but try to keep that elbow right in. There you go. And hold with two hands, and I think you did two-handed pullbacks. Well, here the pullbacks is just more scapular. Well, and you could, when you do the dumbbells, like the push-pull, you still on the pullback, you definitely get that whole scapular motion too, strengthening. And we do have her. So Shelley, go ahead and turn around, and we did pull forwards too. So just really too getting those muscle groups working in all different directions. Just a little more protraction, retraction motion again. So just really keep that elbow straight on those, Shelley. So it's just all the movement's really coming from that shoulder and shoulder blade, especially on that pull back. There you go. The tendency is to want, because it gets so tight, the tendency is to want to bend that elbow again for making you feel like you're moving more. This exercise is usually really hard for people. The next piece is to turn palm up so you get more external rotation. Because you really have to use your shoulder to do that correctly. And then Shelley, the other one was just thumb down, so it's a little more internal rotation. That wrist straight. I think that she just, from the surgeon standpoint, developed scar tissue much more quickly than an average person, and that's what happened. Because I think he even said he wished he would have put her in therapy that much sooner. They had given her stuff to do at home, which she did, but told her not to progress, to the next set of exercises until a certain point, and that was not quick enough for her. Her flexion, I think, was around 120, and I think the last we measured, she's about 160. Abduction was about the same, and that's improved. She's probably at 145 or so of abduction now. Her biggest limitations were rotations. Her external and internal rotation were at like 30, and now we've gotten her to 60 or 70 with a fair amount of stretching.